Hello, I'm Rebecca Hoffman. I have a family practice clinic in Traverse City. I've been in practice for 20 years this year. Opened out a residency, and I'm a single provider DO with two NPs and a PA on staff with me, and they do have their own patient panels as well. And we're in rural northern Michigan. Most of you are probably familiar with Traverse City. And we have eClinical EMR as well. So we had 31 patients attributed to us and we had 100%, which was great. And basically, I don't use a lot of reminders. I don't use a lot of, I don't take advantage of my EMR at all, probably for a lot of these kind of things. I don't have an office manager. I'm kind of independent, kind of old school, I guess you would say. So basically, I just try to be consistent, and basically how I see most of my diabetics, I see them, at least twice a year, most of them 3 to 4 times a year. My goal is to try to get their urine done for the first visit of the year. So no matter if, for their physicals or whatever I'm seeing them for the first visit, if they're going to be seen January, February, March, it's just always ordered for that first visit. I pre-order my labs from the visit before. So I just always know that if I see them the end of if I see them in the fall, I just always know that my first visit of the year, I'll make sure that I have it ordered. Most of my patients at that point kind of are used to that, and they know that they always ask me. So I get 1 urine sample a year, yes, and they're pretty prepared for it. We also we have patients that come to our office to do their blood work and also go to a lab, so it's kind of a mix. And then I do have my RN who will follow up maybe mid-year just to make sure that the people that either haven't come in or that we have missed or couldn't leave a urine sample, that we do catch up on them. Next. So kind of pretty similar to what I already said. I as the only physician, I review all my NP's notes as well. So if they don't have it ordered for the beginning of the year, I just go ahead and order it usually for them. And then my MAs are aware that they look when they come in they'll do the diabetic flow sheet when they come in and room the patient. And if they haven't had one, I'll just ask them to leave a urine at that appointment. And if they don't catch it if it wasn't done at the lab, I pre-review my labs. And so I see that it wasn't done, and I usually just leave a note for my staff to make sure that they ask them to leave a urine before I see them for their appointment. And for the most part, this has worked really well for us. I think voicing what the previous person said, I think the lab can be kind of the biggest barrier. Some labs, up here, we have a lot of turnover at all the labs. And so I think people don't even know it's a urine test sometimes. And so they don't even ask them to leave a urine. So that's, again, as long as you're educating your staff and they know that they need to do it once a year, and they realize that they haven't done it, or they ask them to do your urine, then most of the times, most of our diabetics are just kind of used to this by now. And a little bit, sometimes we have one of our big endocrine CR diabetics. I'm sure you guys have this issue where they don't seem to do anything but their A1C for whatever reason. And so I'm like, okay, well, then they're like, why are you doing this? I'm like, because I need it for because you're supposed to have it done. So just please pee in a cup for me because you're here. And most of the time, if you have open relationships with your patients and you just kind of share while you're doing it, you're just trying to follow up on all all of their healthcare, then most of the time people, I think if you have a good relationship with them as their primary care provider, even if you're not the person that's really truly managing their diabetes, you know, I don't really understand sometimes why they don't check their lipids. They don't check their kidney function. I don't know, but it is what it is. So you just kind of have to be proactive. And I think just the longer you're in practice and you just get used to doing these things and following up. And I think if anybody that's been in primary care long enough just knows that this is just what we do and we just get better, you know, get good at it. We're a really small practice, so our patients, you know us well and have good relationships with my staff. So I think that helps too, because people are just kind of willing to just follow up. If somebody in our office says you need to leave a urine sample, they just will do it. And most people really, the only time, again, usually they can't leave urine, or my biggest thing that people complain about is they think I'm drug screening them when I'm asking them to leave urine. So if you just explain to them that's not what you're doing, then usually there's not an issue. So they came up with a few examples. Really, like I said, I'll see somebody for their physical in July, and then I know they're going to have a 6-month follow-up. I just will always order those labs. I really try to just do all of the basic labs at the beginning of the year, because that way you just don't miss everything. You don't miss the lipids, you don't miss the kidney function. And then if you do it all at the beginning of the year, if you have an in-house A1C point of care testing, then at least you know you can do their A1Cs as they go, but you got all the rest of their labs at the beginning of the year. So that's pretty straightforward. Not a lot of complicated things, but it seems to work really well for our practice.
Do you want to go through this patient example, Dr. Hoffman, that was included on here before we turn it over to Dr. Workman for his presentation?
Sure. So let's see. Yeah, so basically just, yes, if as they check out, we always try to schedule them for nurse visits in our office, or we put a reminder in our system also that if they aren't going to get labs at our office, that we will send them a reminder like 2 weeks before to go get blood work done. So all the labs are pre-ordered, but then we do either prompt them to do the labs. We make sure they do them when they come in for the office, or we remind them to go do them at the lab. And as the previous presenter said, we'll remind them, like, remember, you are going to have to leave a urine. And I think if you prompt people to do that, that's helpful too. And then we will kind of check in like mid-year just to kind of make sure. But in general, if you're seeing hopefully most people are seeing their diabetics a couple times a year at least. So you should be able to catch it at least one of those visits.
Right, great. Thank you so much, Dr. Hoffman. We really appreciate it. There was a question in the chat, if you're able to respond, just about if patients you know anything about if they're charged differently, if it hasn't been a full year since their previous one. If you have any insight on that you want to share in the chat, or if anyone else does, that would be great.